of duty to save lives and to nurse our sick ones to health. We also congratulate all those that have been discharged and urge them to come out and tell their stories as a source of encouragement to those that have not availed themselves the opportunity of the healthcare system and the provisions in the isolation centers. We need to tell Nigerians that COVID-19 is real, that it is deadly, and that prevention is better than cure. There is no better convincing and compelling evidence of the reality of the dangers than the experiences of our compatriots who have gone through that experience. The Presidential Task Force reported the progress made with the evacuation of some Nigerians from the United Arab Emirates, the United Kingdom, and the United States of America. We also informed you about the mandatory quarantine protocol. Nigerians have in the past or recent days been served with different audio-visual clips by some of the returnees. The Presidential Task Force is saddened by the conduct of some of the returnees who failed to adhere to the conditions attached to the quarantine. I strongly urge them to obey the rules in the facilities and also urge their friends and relations to recognize the contagious nature of the disease by desisting from visiting them. Complying is in the interests of the visiting relation and in the overall public interest. The Presidential Task Force is pleased to inform you that it has facilitated the visit of the national leadership of the Nigerian Medical Association, JHESU, the National Association of Nurses and Midwives, the Pharmaceutical Society of Nigeria, Association of Health Professionals, and the National Association of Resident Doctors to Lagos and Kano. Unfortunately, due to traffic gridlock, the delegation could not carry out its mission in Lagos and will repeat it in the coming week. This collaboration underscores the importance the Presidential Task Force attaches to inclusiveness in the battle against COVID-19. It also reassures our medical personnel that they remain a top priority for government in this effort. The Presidential Task Force welcomes the resolution of the Nigeria Governors Forum to take steps to ramp up testing and provide the prescribed minimum number of bed spaces in their isolation stroke treatment centers. We, in turn, assure the states that the Nigerian Center for Disease Control will continue to provide technical support and standardization guidelines. It will also continue to firmly pursue its surveillance activities nationwide. We urge the states to recognize the essence of a strong partnership and always allow overarching public interests to prevail. Finally, let me remind all Nigerians that in this battle, vigilance is required, self-preservation is important, collective action is necessary, and compliance with guidelines is imperative. All this will help us prevent infection. I now cede the podium to the Honorable Minister of Health, the DG Nigerian Center for Disease Control, and the National Coordinator to update you on recent and current developments. And I wish to thank you for your kind attention. Thank you.
The Secretary to the Government of the Federation, honorable ministers here present, our permanent secretaries, directors and directors general, ladies and gentlemen of the press. Yesterday, the 13th of May, 2020, 184 new cases of COVID-19 were recorded in 22 states. A breakdown of the cases by states shows Lagos 51, Jigawa 23, Bauchi 16, Katsina 16, Kano 14, FCT 10, Rivers 10, Kwara 9, Delta 5, Kaduna 5, Sokoto 4, Oyo 4, Kebbi 3, Nasarawa 3, Osun 3, Ondo 2, Ebonyi 1, Edo 1, Enugu 1, Anambra 1, Plateau, Niger 1 each. 6 fatalities were recorded in the same period, bringing to 4,000 the total number of cases in the country to 4,971 on record, confirmed in Nigeria, with sadly total of 164 fatalities. So far, 1,071 patients have been treated and discharged. As we inch towards significant milestones in our COVID-19 statistics, we are looking at all options to adjust our approach to the emerging situation. The Federal Ministry of Health and its agencies, particularly the Nigeria Center for Disease Control and the Nigeria National Primary Healthcare Development Agency, have scaled up training in infection prevention and control, case finding, case management, emergency patient transportation systems, surveillance outbreak response management analysis system, known as SOMAS, all the way down to training of hygienists, stretcher bearers, security personnel, and all others you will find manning isolation and treatment centers. This will increase confidence in the health system, reduce incidents of infection, and also reduce instances of desertion and improve overall performance. We have also deployed commodities like personal protective equipment and other supplies to the states and to federal health institutions, and in addition continued with supplies to laboratories to forestall the much reported delays arising from shortages. These measures and others are to address the needs reported to us by the Federal Ministry of Health team presently deployed in Kano, which has also paid exploratory visits to Jigawa, Bauchi, and Katsina, and is preparing to visit Sokoto and Borno very soon. Part of the needs already identified is the urgent necessity of on-site laboratories with molecular diagnostic capacity to reduce the presently extended turnaround time for results. Practical hand-holding personnel training has also been requested for some of the health systems who have had little experience in the past with infectious disease management. To this end, more personnel is to be deployed from the Federal Infectious Disease Hospital in Irua, while the kind offer of Lagos and the Ekiti State governors will also be drawn upon to send experienced health workers to assist. Step-down training will be a priority in the entire exercise to build capacity down to the level of community health workers in the bid to sustain safe and comprehensive delivery of COVID-19 services. The Federal Ministries of Health and the Federal Capital Territory held a ministerial meeting today and agreed on a firm synergistic collaboration and cooperation framework to respond to the challenges of COVID-19 in the Federal Capital Territory. A joint committee led by the Honorable Minister of State for Health and including the permanent secretaries of both ministries was created to oversee the newly donated this-day dome treatment facility. The initial medical team is to be headed by the Chief Medical Director of Federal Teaching Hospital, Irwa, and his team, and the training regimen will be instituted to build the capacities of workers there. We also paid an inspection visit to the 600-bed COVID-19 treatment center at Idu, a flagship project of the Federal Capital Territory. Also slated for special emphasis is the delivery of routine service in all our hospitals in the country. Latest statistics from the National Health Management Information System indicates that outpatient visit has dropped from 4 million to about 2 million, antenatal visits from 1.3 million to 655,000, skilled bed attendance from 158,000 to less than 99,000, while immunization services has dropped to about half. All these have as yet undetermined consequences, which the easing of the lockdown should hopefully address. As you all know, we have insisted on sending members from Family Health Department and also asking Primary Healthcare Department, Primary Healthcare Development Agency to accompany the mission in Kano in order to stir up and activate routine services, which has been going on very well. However, the downside of easing the restrictions in the country needs to be balanced off by all citizens with a collective determination by all of us, not only to comply with protective and prophylactic advisories, but to encourage relatives, friends, neighbors, and customers to do the same. The use of facial covers like masks in places where social distancing may be difficult or impractical should be supported by all of us and emphasized through donation of population as an act of goodwill. Face masks should become commonplace, and I look forward to seeing cooks and food vendors, for example, wearing masks or risk losing customers. I wish to enjoin workplaces to also institute such requirements and ensure that all workers are masked and knowledgeable about COVID-19 and by extension to share with their families and relations. We must realize that the wearing of masks is not an alternative but a supportive initiative, and it is a least that we can do to protect ourselves and our opponents. Also, while on face-to-face communication, your mask needs not be removed, otherwise the purpose is defeated. I wish to use this opportunity to thank traditional, religious, and community leaders who have supported the mask-wearing initiative by ensuring that their subjects use masks as a minimum form of self-protection. The present rate of community transmission makes these measures and other similar measures to be helpful. We shall encourage state commissioners of health and their staff through the information technology platform to continue training and retraining their health workers in their states as more information of COVID-19 is received, to ensure that learnings and exchange of ideas and experiences from other countries is shared. We have been in discussions with multinationals and developing partners such as the World Health Organization and Global Fund, who help us in planning our needs and our processes and our procurements. Funds are also being repurposed for use in further increasing our diagnostic capacity and providing personal protective equipment for our health workers. I shall conclude by thanking all governors for their leadership they are showing in response to this virus, and also our citizens for adhering to public health advisories. The visit to Cross River State will be scheduled as soon as we can arrange the transport, and also to Kogi State as soon as details are worked out. I thank you all for your attention.
So, Chairman of the Presidential Task Force and Secretary of the Federal Government, Honorable Ministers, gentlemen and ladies of the press. Let me start by acknowledging the very important work the Honorable Ministers of Health are doing in terms of re-energizing the rest of the health sector. I think it's become clear to all of us that we will have to learn to live with this virus for some time to come. And living with it means not only saving lives from the virus, but saving lives from all the other things that afflict us. So we must keep our primary health care working, which is why the work of the National Primary Health Care Development Agency has become more important than ever before. We must keep people on antiretrovirals on treatment, which is why the work of the National Agency for the Control of AIDS is more important than ever before. And we must not forget that our fragile national health insurance system needs to continue evolving. So all those bits and pieces across the health sector are extremely critical as we come to terms with the reality that we face. Having said that, I want to focus a little bit today on Nigeria's response in the global context. Over the last few days, there have been a lot of, very emotional and actually correct, to some extent, statements about looking inwards. And there's nothing more important that we should do than look inwards. But we must also remember that this is not a Nigerian outbreak. It's a global outbreak. And we have to engage globally. That global engagement starts from science and understanding the factors driving this outbreak in Nigeria and globally. And as we watch TV every evening, we have seen where science has come in conflict with politics. And I'm actually very proud that in Nigeria and in the political leadership of Nigeria, that our leaders have actually listened to the science and used the science to drive action and based the entire response in Nigeria on the science as we understand it. And as we look globally, it's not enough to look at the countries who have the privilege to transmit to our sitting rooms every day. At the Nigeria Center for Disease Control, I tried to push the team to look at countries like India, look at countries like Brazil, at Mexico, that share a similar demographic to us and face similar challenges. We've been intrigued over the last few days of a big prison outbreak in Colombia, where 30 to 50% of the prison inmates in Colombia have been tested positive for COVID-19. And what does that mean for us and our preparedness? And how do we now have to start adapting our response and preparedness to these new circumstances? In Mexico, there have been large numbers of healthcare workers infected. Now, of course, it is sad for a healthcare worker to be infected. They are on the front lines. But the bigger impact is that it has now caused staff shortages across the health sector, that the hospitals and clinics are now unable to provide the care that they need to provide. In Chile, intensive care has almost completely collapsed because capacity has been exceeded. So these are countries we need to look at because of similarities in demography, similarities in population density in their cities, and similarities in terms of population profile. And that is what we kind of try to do, and we're trying to do now. So slowly, we are rethinking our response at the Nigeria Center for Disease Control from one of just going around and trying to subdue the impact of the outbreak to one that's increasingly science-led, evidence-led. We want to dig deeper into what is driving this outbreak in certain parts of the country and use that to inform the response. So how has this changed our work? Over the last few days, we're beginning to focus a little bit more on the research side of things. We've brought together TETFund, the Nigerian Universities Commission, under the leadership of the Honorable Minister of State for Health, to start thinking about what are the research priorities for us in Nigeria and how can we drive this research, not just in the long term, but also in the short term. And how can we now use this to improve our own guidelines, improve our training, and become a point of reference for our own response. We're participating in the World Health Organization Solidarity Trial. What does a solidarity trial mean? It means that no country on its own will have sufficient cases and interventions to have the scope of a study needed. So you bring together the data from different countries and pool them into one big study. And that's why it's called a solidarity trial, because we're all working together to the same output. We've shared our initial sequencing of the first viruses, and many colleagues are doing a lot more of that. We've just started a study called the first few hundred cases, and a protocol adapted from WHO's protocol, which we will share with many other countries. So we're working with ACEGID, with NIMA, with the Center for Human Virology and Genomics, the Center for Human and Zoonotic Virology at LUTH, and many other partners in the academic sphere to start thinking about how do we develop our response further. We're also activating our influenza surveillance network so we can use that to base a new surveillance system that would try to estimate the incidence of COVID in patients just coming to hospitals as they would normally come with respiratory infections. Now, why is all of this important? Why do we need the science and why do we need to engage globally? You know, the end of this outbreak will come when we get a vaccine. But getting a vaccine doesn't mean inevitably that we will have access to it. We have had a vaccine to human papillomavirus for the last 10 years. But because this vaccine costs about $50 per shot, we don't have access to it in Nigeria. So we have to engage globally to insist on equitable access to these vaccines when they are developed. We will not do that by looking inwards. We'll do it by engaging globally, by making the case for access to these vaccines. We must engage globally to have more access to diagnostics. That is one of our biggest bottlenecks now. Why don't we have access? Because the market for diagnosis is skewed in such a way that access is a big problem for us down here. We must fight to have more access to therapeutics, to medical countermeasures, and to everything we need to fight this disease way into the future. This is why we need to engage globally in a lot of these things. So as we look inwards, we must also look outwards. No country can solve this problem on its own. We have to work with others on the science, on global health politics. We need to come together as a global health community. And we can only get out of this if we know and believe that we can only be stronger together. Thank you.
The Secretary to the Government of the Federation, members of the Presidential Task Force, ladies and gentlemen of the press, good evening. Today I would like to talk about the common misconceptions on COVID-19, but before I do that, I need to just say a few words on security and surveillance. As we all know, COVID-19 has brought with it its own security challenges. The PTF continues to ensure that citizens' safety is prioritized during the pandemic. It is particularly important to emphasize the importance of free movement of goods while restricting unnecessary, non-essential interstate movement of people. So to this end, the PTF continues to urge security agencies to reinforce their surveillance across the states to ensure the protection of lives and property. So now to the issue of common misconceptions on COVID-19. As we all know, they say knowledge is power, and by having that knowledge, you will be able to protect yourselves. As stated by the DG and CDC, the national response is driven by science, it's driven by evidence and by data. So I'd like to go through a few common misconceptions on COVID so that we can all educate ourselves and remain safe. So the first one has to do with climate. Hot climates prevent the spread of COVID-19. Well, no matter how sunny or humid the weather is, anybody can get COVID-19. Nigeria has recorded a total of almost 5,000 cases to date, irrespective of the fact that we are actually a hot country. There is also no scientific evidence to show that coronavirus cannot survive in hot weather. The best way to protect ourselves against COVID-19 is by maintaining physical distance, washing our hands, avoiding mass gatherings, maintaining physical distances, etc. The second misconception has to do with the fact that people who have recovered should be avoided. Well, actually, if you recover from COVID and you're no longer excreting the virus, you're in the best position to be considered safe. It's important that we continue to regard COVID as a disease that does not respect gender, socio-economic class, age, or geographic location. We must also stop stigmatization of people with COVID infection. Once you recover from COVID, the data is pretty robust that antibody levels are very likely to continue to ensure immunity for some years. Certainly, if we use data from other coronavirus infections such as SARS, CoV, and the MERS infection. So let us stop the stigmatization. Thirdly, the issue of bleach or ethanol can cure COVID-19. Well, bleach should really be used to disinfect surfaces. As we all know, bleach is poisonous. If you take bleach, yes, it could kill the coronavirus on your mucosal surface, but it could also kill you. So it's definitely not advised. The other misconception has to do with the fear that you will catch COVID-19 from a foreigner. Well, you're just as likely to catch COVID from a fellow citizen. At the moment, we have increased cases of community transmission of the virus. Anyone in Nigeria can transmit the disease, so let us please try and protect ourselves and others by adhering to the safety protocols during the eased lockdown phase. And then we've got the issue about Africans cannot catch COVID-19. Well, we are all Africans, and we know that over 70,000 cases of COVID have been diagnosed in Africa, with over 2,000 deaths so far. There's no doubt Africans are getting the virus, and Nigerians are getting the virus as well. So we are not immune on the basis of being Africans. So another common misconception is that for you to have COVID-19, you have to be very sick. No, the majority of persons, up to 8 out of every 10 persons with COVID, will have mild or moderate symptoms that will not even require hospitalization. A lot will not even know that they have picked COVID because the symptoms will be so mild that it will not require them to stop their normal activities. But nevertheless, they could still transmit COVID infection. And that's why we have to protect ourselves at all times. It's not necessary that it's only the person you see on a sick bed that has COVID. It could also be somebody sitting or close to you. Another misconception: wearing a face mask alone is sufficient to protect you from COVID-19. Well, face masks are used to cover the mucosal surfaces of the nose and mouth. As far as I know, there are no face masks that cover the eyes. So you can still catch COVID if you expose yourself to somebody with the infection, especially if you stand very close to the person and that person is talking into your face. So it's important for us to maintain those other measures in addition to using a face mask to make sure that we absolutely protect ourselves from catching this dreadful infection. And then finally, the misconception that COVID-19 is a biological weapon created by governments, or it is a ploy to generate resources. And that cannot be further from the truth. If you're going to generate resources, you wouldn't start by creating a pandemic. It's the last thing you need. In addition to that, almost every country in the world is affected by COVID. Thousands of people have died worldwide from COVID. If it was a biological weapon created by a government, then no government will destroy its own citizens. You would expect that that government would have made sure that their citizens are immune to this. Thank you very much.
Thank you. We have taken all the updates now. We will take the questions from the gentlemen of the press. Okay.
My name is Felix Onwa. I'm from Reuters. My question is directed to Minister of Health. In one of the briefings, we were told that an investigation is being conducted to unearth the mass deaths in Kano. I would like to know whether the report or that investigation has been concluded and what the result is.
Good afternoon, all. My name is Friday Okerigwe. I'm a reporter with Channels TV. My first question goes to the Minister of Health. I'd like to know the whereabouts of the Chinese doctors. Yes. I'd like to know where they are now. Where are they operating from? The second question has to do with, I'd like to know updates about the returnees from Dubai. We're told that a test was conducted on them. What is the update? It's past 4 days or so. What is the result from the test? And I wish the Minister of Humanitarian Affairs here, because it has to do with end power beneficiaries. They are among those who are at home now because they are not rendering essential services. Their salaries, or their stipends rather, have not been paid. What is the plight? What is the fate for them? Thank you.
Good afternoon, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. Well, I have a couple of questions here for the PTF today. And the first one has to do with the upliftment of the Madagascar COVID-19 cure. The SDF, you said on Monday that arrangement is currently being made to lift this consignment from Guinea-Bissau. I want to know, do we have the consignment now, and what's the next stage if we do have the consignment? If we don't have it now, what are the challenges? Because you told us on Monday that the arrangement is already being made. Then, secondly, the DGNC DCSA. You said it is agreed that spaces for treatment are becoming scarce, and I know that you said this times to that number as well. Are you thinking of priority care for those whose conditions are far worse, and do you think it's appropriate to allow those with no symptoms but with capacity to self-isolate in homes while receiving treatments to do so? Then the SGFs, I think you really need to assist us in this area. Some of us who are essential workers keep having these issues with security personnel after most of us would have concluded our assignments in the office. And I remember that you said times to that number here that essential service workers should be allowed to move. But it appears that the directives that the security personnel on the road have is quite different from what the PTF has issued out. Because I had encounter, and in fact, some of my colleagues as well, NTA as well, we had encounters with some security personnel on Monday. Then on yesterday, I had a personal encounter with some of them. And I actually tried to tell them that the guidelines does not state that you shouldn't allow essential workers to move around. But they made me understand that the directive they get from PTF is different from the directive being issued by the FCT. I want you to please help us in a way, perhaps meet with the FCT authority on this matter. Then finally, someone would like to know if non-wearing of face mask is now a criminal offense, as read in the regulations. Thank you so much.
Good afternoon, Chairman and members of the PTF, Nigerians at home. My name is Mitaire Ikpen. I report for the NTA. I want to ask the DG of the NCDC, given that human droplets containing coronavirus can remain on surfaces for hours, some Nigerians want to know, are there other agents of transmission of the coronavirus apart from human to human transmission, like rodents or housefly, which we know perch on surfaces a lot? And for the SGF, we'll have this question. With the coronavirus pandemic, the way we work and live now require greater internet access and connectivity, especially when we want to observe issues of social distancing and abide with the ban against mass gathering beyond 20 persons. So are we expecting new policies or plans by the federal government to increase broadband penetration and enable relevant companies in the industry to provide high-speed internet access, especially across the nation and in the hinterlands? That's the question. Thank you.
Good afternoon, USGF, members of the PTF, my colleagues. My name is Mohammed Saliu Nazif. I work for Voice of Nigeria. My question goes to Minister of Education State, SGF, and Information Minister. I would like to start with Education Minister. Sir, it is on record that the federal government of Nigeria have expended about 15 billion naira to establish Almaijiri School in Nigeria under administration of President Goodluck Ebele Jonathan. What is the state of these schools as of now? And who controlled these schools? What role did your ministry, through UBEC and SUBEC at the state level, play, either to the success or the failure of this Almaijiri system that we are seeing? To SGF, sir, going forward, we have seen how various states are repatriating these Almaijiris to their state of destinations. Is there any profiling going on about them so that post-COVID-19, at least making reference, taking them back to those schools instead of allowing this school to just decay after spending billions of naira on it? To Minister of Information, sir, it's like a reminder, any update concerning insurance policy for the journalists on the front line? Thank you.
Good afternoon all. My name is Nike Adebowale. I report for Premium Times. My question is for the national coordinator, sir. So we're all aware that NCDC was given about 5 billion naira to support its fight against COVID, and Lagos State was also given about 10 billion naira. So I want to know how much has been given to the National Institute for Pharmaceutical Research and Development and other research agencies. Thank you.
Good evening, the SGF, ministers, my colleagues. My question is to the national coordinator. My name is Nancy Anika from Radio Nigeria. It's more of a follow-up with what my colleague from the AIT said. Today, the medical doctors in the FCT held a briefing, and they are threatening to go on strike if the harassment by security agencies do not stop. They say they literally ask them to come down from their cars and sit on the floor once it's curfew, even with the presentation of their ID cards stating that they were on night duty. Please, I would like that to be addressed. Thank you.
Good evening. Good afternoon, members of the PTF. My name is Juliana Taiwo Baloyin. I write for the Sun newspapers. Sir, SGF, sir, again, the Minister of Aviation is not here, but this really concerns him because freight forwarders are threatening to go on strike over demurrage refusal of the two aviation companies on demurrage waivers. And we understand that NACO and HACO have been on strike for the past 2 weeks. Seaport has 100% waivers. Why not airport? This is presidential directive. How come they are not adhering to this directive? Because we believe government and even those involved are losing funds. This is for the Minister of Foreign Affairs. With the refusal of Canadian government to grant Air Peace landing permit, what is the fate of Nigerians there who want to return home? Thank you.
Mo kí alága àti gbogbo ọmọ ìgbìmọ̀. Orúkọ tèmi ni Agboola Elúfowójù láti iléeṣẹ́ móhùnmáwòrán àpapọ̀ NTA. Ìbéèrè mi lọ sọ́dọ̀ Mínísítà fún ètò ìròyìn àti ọ̀rọ̀ àṣà Alhaji Lai Mohammed. Ìbéèrè náà ni pé láìpẹ́ yìí ní ìjọba ìpínlẹ̀ Borno kéde pé òun ti gbẹ́sẹ̀ kúrò lórí òfin ìséde kónílé-ó-gbélé àti pé àwọn ilé ìjọsìn ẹlẹ́sìn Kristi tàbí ti Islam wọ́n lè lọ máa jọ́sìn. Ìbéèrè mi wá ni pé tí àwọn ó ṣeéṣe kí àwọn ìpínlẹ̀ mìíràn náà tẹ̀lé irú ìgbésẹ̀ yìí, ṣé eléyìí ò lè ṣe àkóbá fún àwọn àṣeyọrí tí ó ti wáyé nípa ìgbógun ti àrùn COVID-19?
The Chairman, National Coordinator, members of the Task Force, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question goes to the Minister of State for Education. Well, with the COVID-19, it has compelled us to look at the e-education strategy. But of course, with this, we have seen a lot. We've seen a lot of drawbacks with it as it concerns the shortage of e-education materials for school children. I want to know what your ministry is doing to incentivize local production of e-learning materials for school children and also even laptops, local production to help them get access and learn. And my next question is for the Minister of Health. Well, the president of the Pharmaceutical Association of Nigeria says he has actually written several proposals on indigenous efforts to deal with COVID-19. So I want to get your confirmation if you've actually seen some of those proposals and where we are in terms of, the ones you've seen, the ones that have potentials and what we're doing really. Thank you.
Thank you very much. We have taken all the questions. They have been directed at the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of Information and Culture, Honorable Minister for Foreign Affairs, Honorable Minister of State Education. There's a question for Honorable Minister of Humanitarian Affairs, but she's not here. It's been noted. And the SGF will round it up after all the responses. We shall begin with the Honorable Minister of Health.
Thank you. The first question that came regards the deaths in Kano. Well, I can report that the so-called unexplained deaths were not only in Kano, they have also been recorded or mentioned in connection with other states. And the team that left the Ministry of Health to Kano is looking at all of these, creating a protocol and a system to look into these unexplained deaths. I think they are probably in about 8 places. What he has done so far, what we have agreed that he does to call for pathologists from all over the states concerned and do a training. They have conducted a training. They have also, the pathologists from the teaching hospital of federal ministries, federal medical centers in all of these states. They have conducted a training, developed a protocol on how to approach the investigation into these unexplained deaths, which includes collection of samples and doing what they call a verbal autopsy, which involves asking questions and looking into the circumstances that eyewitnesses can give surrounding the deaths. So it's a very meticulous procedure, and it is going on. Results are not yet out. There are no conclusions with regard to it, and as soon as conclusions come out, you will be given the result. The other one is about Chinese doctors. Well, I want to explain first of all that I think not all of them were doctors, and I think that I heard that some of them are technicians, but they are staff of CCCC. The Ministry of Health is not their host, so we can't always explain what happened to them or where they are. There seems to be a lot of interest in these doctors, but they are the staff of the company, and I think they are on the company visa. So I'll be very happy if you don't ask me about where they are, because they are not really our guests in that sense. But we have been able to learn some things from them by interacting with them from their experience in their country. They did tell us, we shared ideas about what they did in their country, how in managing COVID-19. The question about the Madagascar cure, the SGF will take that one up because you're asking where is it? So where it is, I wouldn't know. The self-isolate at home, yes, it's an option we have been talking about. The NCDC has released a very nice guideline for that, but not everybody is eligible for that. Not everyone. NPHCDA, Primary Healthcare Development Agency, is coming up also has come up with a very beautiful contribution that creates circumstances under which it is safe for some people who have undergone certain questionnaires to be at home, but definitely supervised self-isolation, but it's not for everyone. Now, he will be able to add more to it when he comes on here. Now, the non-wearing of masks, we are not saying it's a crime. If it is recommended that something is good for your health, I think you don't need to question. It doesn't have to be a law before you do that. But if something is good for you and good for me, then definitely it's a very sound advisory. You don't need to make a law out of that. If you wear a mask and I don't, there's a certain percentage of protection for one of us. If both of us wear masks, we are protecting ourselves. According to some studies, which I'm not sure they are confirmed, but there are studies which say that up to 90% protection from mutual. But it's not a protection. Absolutely, not 100% protection. And then back to the Pharmaceutical Society, we encourage all those who have an answer, who think they have an answer to the COVID-19 problem, to go ahead and do the research they want to do. Our universities are there. We have research centers. The ministry itself is just a regulator. We overlook all of this. NAFDAC is there to certify what you need to do. You don't have to, you can go to them. You don't have to push everything you want to do into the ministry. The ministry is not the one to give you permission. You can get, there's a point where you have to, if you want to do a test, you go through, do ethical trials. There's a committee that will allow you to do ethical trials where you are doing phase 1, phase 2. So there are processes for that. And it's not to be imagined that the ministry is trying to stop anybody, or that the ministry is the one to give you your permission, your encouragement. But certainly the ministry will not start giving anybody money to go and do things unless they are looking at a grant for it. There are organizations that give grants to do research in itself. I think that covers the question. Thank you.
What is the result of the returnees from Dubai?
On what?
The returnees from Dubai. What is the result?
The returnees from Dubai and from the UK and from the US, they are still within their 14 days of quarantine. There is no report or no result yet. They are still under observation. After 10 days or 11 days, they will have tests done, and that test will show who is positive and who is not. So it's a routine process they are under now, routine quarantine that goes for 14 days. That it made me, yeah, we met long ago, but it wasn't in connection with COVID-19. It was in connection with something else. And those who have written to me in connection with COVID-19 have been giving replies, but Pharmaceutical Society didn't discuss specifically COVID-19. We also encourage them, if they have research interests, fine. There are some who have written to ask for permit waiver on importing certain things, certain particular drugs, which has been dealt with routinely. If you are asking to get permit to import a certain substance, it's dealt with administratively and is routine. There's a certain process for that.
So thank you. Friday, just to affirm what my honorable minister said, we're doing this test. Even when the tests are out, we're not going to come back and offer you the results, right? We'll offer it to the patients, and if there are patients, and we'll manage that. So we're not going to share results from whether you've come back from Dubai or whether you're living in Nigeria. The results are meant for the patients who got tested. Secondly, there was a question on prioritization of care facilities. Yes, we are working very hard to prioritize care facilities for those who need it the most. But you have to remember the circumstances are different. Right? There are states like Lagos and Kano where there are a lot of infections, the burden is very high, the transmission is intense. The response in terms of institutional care will be different than in many states where we have 1 or 2 cases and we're fighting very hard to minimize the impact on the health sector. So the policy of government remains to provide institutional care for everyone infected. But there are certain circumstances where this is not possible. There could also be individual circumstances, a different illness, personal circumstances that limit that person from going into an institution. In that case, we will offer an alternative, and that's what we're working. But the policy of government remains institutional care for everyone for now. And the third question really was from NTA. I think that was around whether there were other mechanisms of transmission from rodents or flies from surfaces. There are none that we know of at the moment. But those surfaces are important. So let me just use this as an opportunity to advise, we need to wipe our surfaces regularly. So if you work in an office where there's a staircase and everybody touches that staircase as you're going up, get one of the cleaners. The easiest thing is bleach. Dilute bleach with about half a cup of bleach to 1 gallon of water, and use that to regularly disinfect surfaces where people put their hands on all the time. So places like this, the handles of staircase, handles of doors, all those things that where there's a lot of traffic and people handle all the time. It's important that we wipe those surfaces as often as we can with a very simple disinfectant. Mix half a cup of bleach with a gallon of water. You get a very effective disinfectant to wipe all your surfaces. So thank you very much.
So I think I have a few questions. Essential service workers not allowed free movement in the FCT especially. Apparently the directive is different. And the issue of medical doctors being harassed, and other essential services. So as far as the PTF is concerned, our guidelines and directives are very clear. Essential workers need to be allowed free movement. If you fall within that category, you should be allowed to move around for the purpose of your job. It's important that we continue to maintain our services across the country. We also need some semblance of economic activity while we are trying to get on top of this issue. I'll be surprised that the FCT guidelines are any different, but I will be in touch with the Secretary for Health Services in the FCT and the chair of the FCT task force to find out if their guidelines are any different. From the point of view of harassment by security agencies, we will raise it again. We have discussed with the security chiefs. While we plead with the public to continue to respect our security services that are doing their job, it is also very important that security services treat the general public with the dignity they deserve. In terms of the other question had to do with, NCDC was given 5 billion, Lagos was given 10 billion. Why haven't we given NIPRID and NIMA? Well, these agencies and government were directly implementing COVID programs. We very much appreciate the importance of research. In fact, we have a pillar within the PTF, that's a research pillar that will be looking at different proposals. We have a small amount of money in our budget for research, but research institutions primarily get their money through grants. So a lot of the research that is going on globally and also in the country is driven by grants from different donor agencies, voluntary services, etc. So what we have in the PTF budget will be insufficient to provide for every research body. But certainly we have partners such as NIMA and also NIPRID that will continue to support to make sure that they submit quality applications that would allow them to compete in the world of research. Thank you.
Thank you, Mr. Chairman, and members of the PTF COVID-19 and gentlemen of the press. On the issue of insurance for journalists, I think we have to be quite frank with one another. It is the responsibility of the employers of labor to provide insurance for the employees at this kind of time. And whether it be private, federal government or state government, I think they have the responsibility to provide for insurance for their frontline workers at this time. And I hope that various media houses at whatever level will take the opportunity of the pandemic to ensure that insurance covers are included in the condition of service of their workers. I have no doubt that the various employers of labor will see what we are saying. If they need persuasion, will not be averse to it. But don't forget that I also have a big responsibility because I'm also an employer of journalists who are on the front line. So I believe that we have responsibilities to our employees. On the issue of Borno, which was asked in Yoruba, I would explain, I will give my position first in English, then in Yoruba. On Borno State, I also read that the government has ordered for relaxation of lockdown. But we still don't have the full picture yet, and therefore it will be premature for me to comment on this situation. But as we are always working together with the Nigerian Governors Forum, we believe that the governors won't do anything that will put in jeopardy all we've achieved in the last few weeks of lockdown. So I think it's better that we continue the engagement, and I'm sure that the chairman of the task force, who is constantly in touch with the governors, will take up this matter, and we hope that we'll be able to give you feedback when next we're here. Ní Yorùbá, wọ́n ní Yorùbá bọ̀, wọ́n ní àrùn tó ń ṣe abọ́yadé, gbogbo ọlọ́ya ni ló ń ṣe. Lóòótọ́ ìbéèrè tó mọ́gbọ́n wá ní ìbéèrè ní ọ̀rọ̀ tẹ́ béèrè yìí. Lóòótọ́ àwa náà kà, ṣùgbọ́n àti ní àǹfààní láti bá gómìnà ìbílẹ̀ Borno àti béèrè lọ́wọ́ wọn wípé ṣé lóòótọ́ ni tí wọ́n sọ wípé kí mọ́ṣáláṣí àti ilé ìjọsìn pé kí wọ́n máa ṣe bí wọ́n ṣe ń ṣe tẹ́lẹ̀tẹ́lẹ̀. Tó fà á tí à ń lè fi sọ pàtó pé tí wọ́n ṣe ó dáa tàbí ò dáa ni pé àyífá orí olórí ní ẹ̀yìn olórí. A fẹ́ béèrè lọ́wọ́ gómìnà náà pé ṣé lóòótọ́ ni wọ́n sọ bẹ́ẹ̀. Ẹ má gbàgbé wípé gbogbo ìgbà ni àwa àti àwọn gómìnà ni là ń sọ̀rọ̀, a dẹ̀ ń fúnra wa nímọ̀ràn, a sì ní ìdánilójú wípé àwọn bí àwa ṣe ń dè wọn ò ní máa tú. Táwa bá ń dè tí wọ́n bá ń tú, á dẹ̀bẹ̀ ni wípé à ń dọ omi sínú apẹ̀rẹ̀. Ẹ fún wa ní àǹfààní ká bá gómìnà ìbílẹ̀ Borno, a béèrè lọ́wọ́ wọn wípé ṣé lóòótọ́ ni tí àwọn oníwèé ìròyìn sọ, kó sì ṣe àlàyé fún wa ìdí tí ó fi ṣe bẹ́ẹ̀. Láìpẹ́ a wà fún yín ní èsì ohun tó bá sọ. Ẹ ṣé púpọ̀.
Thank you. Honorable Minister of Foreign Affairs.
Good evening, everybody. The question was in respect of evacuation of Nigerians from Canada and the news that the Canadian government had denied landing rights to the Nigerian carrier that was supposed to undertake the evacuation. Now, this is the case, indeed, that the Canadian government denied landing rights on the grounds that this particular carrier, Nigerian carrier, did not have a license to undertake commercial flights to that country, and was not known to that country for commercial flights. Our ambassador, our high commissioner in Canada, is engaging with the Canadian government on this issue, and we are hopeful that we can have the decision reversed. The argument that he's putting forward, which is a strong argument, is that this is not a regular commercial flight to Canada to take passengers, but that this is an emergency flight and that there is a difference between the two. So the negotiations are ongoing, and we hope that there will be a positive result. So thank you very much.
Education.
Good evening, everybody. The first question relates to what we are doing with the Sangaya schools. Indeed, you are correct. Over 157 such schools were built a few years back. Within the first part of this administration, the Honorable Minister of Education, Malam Adamu Adamu, began the process of getting different state governments and Islamic scholars to take over these schools. I happen to be privileged to have come in quick in August when I handed over the first few ones in Bauchi. We handed over to Sheikh Dawir Bauchi to begin this process. Many of them, the locations are a little bit far off, and some governors have requested to change their purpose in Gombe. I also agreed with the governor to turn one of them into a college of education, because states are reacting to what they do not have and to use the facilities in the best way possible. We fully agree with the northern governors on the arrangement to take in and take back all Almaijiris. Indeed, they are actually obeying the law, because the UBEC Act of 2004 demands that there will be a local government enforcement body to make sure that all these children return back to schools. The argument is not whether what they are doing is right. The argument is whether the time is auspicious. And if you look at the argument the governors have made, they said this is about the best period to capture everybody where they are because they are not moving. And that argument is extremely plausible. We only reacted in line with the regulations that had been imposed about curfew in between states and whether this was an essential service at this time. However, we are working with all state governors and all sects in the north who may want to use these facilities. They are all available, and we are continuously engaging with them to either improve them or use them in the best way possible. So they are not a waste. And the money that had been spent, maybe you may have issues with how it was spent, but those facilities are there, and we are now putting them into use. We hope that with what has now happened with taking off some of our children off the streets, and then finding a way to progress them into and mainstream them into formal system, we can then use most of those facilities. That's for Sangaya schools. The second part of the question relates to what we are doing with e-education. I'm happy you noted that we've expanded its use within this period. Yes, we were in the process of even making that a bit more useful. And like I said, and I've done this severally at several fronts, we welcome all participants. A lot of Nigerians have been very creative. They've joined forces with us. We've looked at all the online learning platforms that Nigerians have developed. There are almost 60-something of them, and we meet with them regularly. And whatever they can offer to their students, we encourage them to do. But you pointed out something that is really at the heart of it. Access. There is limited access because not everybody has the platform to access this. Limited devices. Nigeria is not a technology survey. Well, we're not producing. So everything that you're going to use, like every other thing, is imported. This is a period of complete lockdown. Infrastructure around the world is channeled towards different things, even if we had the money. And unfortunately, spending in education has not been optimal. So it's not really a question of acquiring laptops and giving to everybody tomorrow. We are encouraging local assembly and knowledge around it. We are discussing with a lot of the manufacturers. We've received letters from Xenox. We've received letters from the HP manufacturing plant in Owerri. We've heard from all the people who want to supply us. We're also opening up the Ministry of Education to be a conduit with which those who have can send to those who do not have. For instance, we're now allowing a credit scheme over a 5-year period for those who are in polytechnics, colleges of education, who do not have these tablets and laptops, to make an acquisition with alongside those who say they have. And we're trying to do that, make that connection, have an interface between us and the origin, and keep the prices at where the students can actually manage it over time. We're also making available all resources that the ministry already has. And like I pointed out, we are broadcasting over radios, terrestrial television. We've made that available to all the states. And I'm happy to note that every state governor has made a lot of effort and are actually running it. The local broadcasting stations have timetables for almost all of our subjects. Our biggest concern is to make sure that those who are at the fringe of society, those who do not have access to most of these, even the common radio, many people do not have access to this. And those are those we are reaching out. We are also working with the Humanitarian Affairs Ministry as they begin today, because there's a lot of work planning with getting food to the students who we normally, this would have been a source for one of the reasons why people come to school is to at least get a meal a day. So this encouragement, we're also using the mediums as they get to the homes to appeal to parents. We're bringing you this food, but we want you to please listen to this program at so and so time. Can you make the radio available to this child? Can somebody please get him to sit down? As children, you know, children are restless. They may not necessarily be. So we are partnering solely with parents. And that is one of the incentives around taking this food home, so that parents can have also some participation in making sure that the children learn with what we are learning. Thank you.
Thank you very much. We shall now take the SGF.
Quite some questions here. But I think a lot of them have been answered by my colleagues. But I will just do some bit of clarification to bring emphasis. There was a question that had to deal with the issue of mask and cloth covering, whether it was an optional thing. No. Because we are persuasive does not mean that there's an option to read. It was part of the declaration that was signed by Mr. President. All the protocols are predicated on the authority vested on Mr. President by the Quarantine Act. And once he attests his signature to that, everything listed there has the force of law. Our appeal is born out of the fact that it's a collective effort, that each and every Nigerian has a responsibility unto himself and to other Nigerians to ensure that when we are in the open, we wear a mask, not necessarily a medical mask like what I'm having. And that's why we say mask stock, cloth covering. We were deliberate about it so that our people do not go about picking things from the dustbin and just hanging on their faces. And simple about it so that even a handkerchief can serve the purpose, not to add additional expenditure to our people. So it is not in any way an optional thing, it's a must. And we are appealing to the security agencies and the state governments or the subnational entities who have the power of enforcement, along with the Minister for the Federal Capital Territory, to ensure that that is enforced. Because it's very, very important that we inculcate this culture of doing things for the overall good of everybody. The issue of Madagascar, let me explain. Nigeria did not ask Madagascar for any solution. That has to be very, very clear, because I've seen some narrative out there giving credence to a line of story that for me I think is only destructive. Nigeria did not ask. The Madagascar government decided to airlift quantities meant for the African countries. That of West Africa was taken to Guinea-Bissau. So all the West African countries, all the members of ECOWAS, have their commodities offloaded in Guinea-Bissau. And that was the one I referred to, that we were making arrangements to evacuate. But the impression out there is as if we abandoned homegrown solution and we were looking for Madagascar solution. We didn't ask for it. But it was taken in the spirit of brotherly love, or African brotherly love, to Guinea-Bissau. And we have asked our ambassador there to establish the location, the quantity. He has done that. We have to make arrangements for its freighting out of Guinea-Bissau. There are no flights. So there are so many things that we have to consider. If we are freighting it through air cargo, that has its process. So please, can you help us explain to Nigerians that Nigeria did not ask for it? It was brought for West African countries, similarly for other parts of Africa. The consignment meant for West Africa was dropped in Guinea-Bissau, and every ECOWAS member nation has been asked to go to Guinea-Bissau and pick. It's not our priority now, it's not a focus. There are other things that we are dealing with to make sure that we contain the spread in our nation. We will do that. But that does not in any way downplay what we have asked our researchers and our scientists to do. In the last one or more week, I have consistently made this appeal. And for those that have been in the field of development in medicine and different inventions, they know the protocol. But I can tell you that I get letters on a daily basis telling me that I have this invention. This afternoon, I received one with even the consignment. So I was wondering whether I was going to bring it here to try it on some of you. That is not the protocol. The protocol is to submit this thing to the appropriate organization that has the responsibility, that is known, established by government through an act of parliament, for it to go through the processes of validation. It is not the responsibility of the task force to validate these things. So my appeal to our scientists and our researchers don't bother sending them to the task force. Send them to the institutions that have been set up by government to do their job. And we know the institutions. NAFDAC is there. It's a body acknowledged and recognized all over the world. Not only for homegrown cure. Anything you want to bring into this country, if it is food or drugs, you must subject it to the validation process in NAFDAC. And that's why all items carry NAFDAC number. If you send it to the chairman of the task force, will he give you a NAFDAC number? How? The task force is a body that has been put in place to provide a national response to the pandemic. We will not take over the responsibilities of agencies of government that have existed in the last couple of decades, who have the primary responsibility of doing what they ought to do. So we'll continue to make that appeal. I read a headline today I have not verified. NAFDAC DG is saying that probably just one. I have not verified, but it is in the papers. It is on the front page of one of the papers. That all the stories that you are hearing and you are reporting on, there's only one that has been bold enough. I said I have not verified, but I saw it on the headlines, and I believe a lot of you sitting here, you saw it on the headlines too, of a major newspaper.